Most people wait until something's wrong to see a doctor. You are not most people. I'm Kevin White. After more than 20 years as an emergency physician, I realized the best medicine is not waiting for the crash. It's helping people stay on the road. This is The Daily Apple, a podcast about living better, longer. Every episode gives you something you can use this week. A smarter habit, a clearer path, or maybe just a new way to think about your health. Because engaged patients are the best patients, and your best years do not have to be behind you. Let's get into it. Hello, everyone, and welcome back to The Daily Apple. And I'm here with the good Dr. Christin Glorioso. And if you listen to us at all, you've heard her talk on NeuroAge, which is really the cutting edge of evaluating and treating cognitive decline early and reversing that essentially, or slowing that pace for sure. And if you have a brain or you know somebody with a brain, you need to really listen to this. It's really timely. It's an exciting time to be in this field as we're seeing some of these things that we can evaluate and treat and, reverse, because you and I both have real risk factors for this. You talked about that before. I've got some markers that are concerning and also in my family history, and I just don't want to go down that path. It's really top of mind, no pun intended. But so tell me about you. So you're the founder and CEO of NeuroAge, as everyone knows, and take it from there on how you got here and everything, because we're going to talk about your personal story, because when we ran into each other at the conference earlier this month, I thought we've got to talk about that, because you really did some things, went on a journey, and then retested yourself in these deep ways and made some astounding changes. So yeah, bring us up to speed.
Yeah, absolutely. Thanks for having me. I'm always happy to be here chatting with you. So a little bit of background on me. So I'm a MD PhD, so I'm a physician and neuroscientist. So my PhD is in neuroscience, and completed my postdoc training at MIT, and I founded NeuroAge. We're coming up on our 4th birthday next year, and I founded the company really because of my own family history of Alzheimer's disease. So my grandmother suffered with Alzheimer's when I was a kid, even starting in her early 70s, so it's like quite early. And unfortunately now it's in the next generation. My aunt is currently pretty late stage with Alzheimer's in her 70s also.
Mm-hmm.
And I myself have a genetic risk factor, as you mentioned. So I have one ApoE4 allele that on average puts people at 2 to 3 times the risk as the general population. It's quite common. So about 25% of people have 1 or 2 ApoE4 alleles. And having 2 puts you at even higher risk than having 1. But the good news is that Alzheimer's, at least the most common forms of it, is really lifestyle dependent. So about 40% of Alzheimer's is due to lifestyle and 60% is genetic. So there's this huge actionable piece of it. And what my previous research showed is that if you can be 5 years younger biologically in your brain aging than you are chronologically, you're 6 times less likely to have Alzheimer's in the future, and you can mitigate all of that risk from 1 or 2 ApoE4 alleles. So that left me thinking, well, if we can help people track their brain aging and help them reverse it or slow it down and be at that 5 years or more younger level, that's really a viable way to help people prevent Alzheimer's in the future and to be cognitively sharp now. So having that younger biological brain age also means people are sharper, they have better moods, they have better memory. So that's, I think, something that everyone can get behind.
Sure. So you said tracking, kind of go through, how NeuroAge tracks that in the first place. How does it gather that information?
Yeah, so we have very comprehensive testing. So we do genetic testing, but that doesn't factor into your score. That just tells you how much you need to be worried about your Alzheimer's risk if you're playing on easy mode. So some people have great genetics and they're very unlikely to ever have Alzheimer's.
Yeah.
Average mode or
those
hard
people.
mode.
Yeah.
So the people with ApoE4 alleles, like me and like many of our clients, are playing on hard mode. So that's fine. Just means you have to be extra healthy, which is good anyway, because it's better for your heart disease risk and your diabetes risk and everything else. So The way that we test people's brain aging is we combine brain MRI. So your brain actually shrinks with age. And so we look at more than 18 areas of the brain and see how much it has shrunk compared to your skull size. So people with smaller head sizes aren't penalized.
Mm-hmm.
And compared to the average person your same age. And then we combine that with cognitive testing. So certain aspects of cognition decline steadily, even starting in your 20s. So how fast your reaction time is.
Mm-hmm.
How many people's names and faces you can remember, how many numbers in a row you can remember. So people on average can remember 7 numbers. That's why phone numbers are 7 digits.
Mm-hmm.
That declines to around 4 numbers by the time you're in your 80s. So that's another one of our tests, names and faces. So we combine that cognitive testing with blood biomarkers, and those are unique to NeuroAge. That's a brain aging signature from the blood. It's based on RNA levels of genes, 52 of them. And you get a separate age for each of those pieces, and then we combine them into a single score using machine learning algorithms.
Mm-hmm. So you've got the brain piece, you've got the imaging piece, and we've done this on a lot of our clients. It's pretty astounding, and it matches the story really, whenever you get into all that. So knowing the score, you can act on it. But so to back that up, you've got the imaging, you've got the brain games, and then you've got the genetic markers. So you've got the blood work that's very personalized, and the imaging, and then the cognitive testing that people do online. So I mean, we've had some patients that we've talked about together, and we're going to hopefully retest one of them pretty soon, but with just some lifestyle things. Like you said, what did you say, 40% is?
100%.
Yeah, that's pretty impressive. What did you think about, I don't know if David Perlmutter was talking about, the inflammation of the brain, and you probably didn't get to hear any of that, but the macrophages change from M2 to M1, and there's this inflammatory process that's consistent that goes on in the brain and contributes to that cognitive decline and dementia. And the interesting thing is, if you change that systemically, like in the body, you're less inflamed by lifestyle changes. That bleeds over into the brain. I mean, it has the effect on the brain as well. So anyway, I'm getting off on a tangent talking about that stuff, but so that's the way you image it, or the way that you evaluate it, those three buckets essentially, right? Am I thinking correctly?
Absolutely. And inflammation is one large category of what increases risk for Alzheimer's. There's other ones as well. Cardiac health, which is very related to inflammation, is also really important. So lipid management strategies. And so we do also, it's not part of our testing, but we do ask people for, basic panels of health markers, including inflammatory markers and metabolic markers and cardiac markers, because all of those things are important for brain health as well.
So whenever you hear somebody saying, "Oh, there's nothing I can do, everybody's demented in my family," when you're at a cocktail party and somebody says that, what's your thought? Do you just kind of cringe, or?
Well, immediately I sort of start to explain to them, that there is this huge thing that you can do, because it's a little sad if you think you're just fated to have this last decade of your life be, without independence and, all of the negative things we associate with severe Alzheimer's disease. So it's just a little bit sad. I immediately try to relieve them and say, oh no, there's definitely things you can do about it. There's definitely not a done deal at all, and the time to start is really now, working on it.
So what is it about? So I do want to get into your story, because I wouldn't even let you even tell me, because I wanted you to tell me here. But whenever I saw you last, I didn't know that you'd done this whole thing, and I guess I haven't read what you've put out, but you looked at yourself and you kind of totally changed the game a little bit personally. So walk me through what you did there and when that started and why you did it. And just tell me that story.
Yeah, so my NeuroAge was I tested my first NeuroAge. I also found out about my ApoE4 allele about 2.5 years ago, in the course of starting the company. So Kind of amazing. I was sitting there with my co-founder when I found out about the ApoE4 allele. Like many people, thought, well, do I want this information? There's not, there, it's just gonna worry me.
Yeah.
And so I found out I had, an ApoE4 allele, and it kind of took my breath away for a second. And then I was like, okay, let's start tackling this, and see what I can do to
Did you go
to
through all the stages of grief before you did that, or what happened?
it really didn't last that. It was only a couple minutes that I kind of
Yeah.
had that rising panic, because
Yeah.
already knew, from my previous research, that there's something you can do about it. So
Right.
immediately I was in action mode. Okay, well,
Hmm.
you find out that there is something that puts you at higher risk, and
Yeah.
not the best news, but now is time to start working on it.
Yeah.
And so then I had my first NeuroAge test, and it was actually hugely relieving, because my brain age was more than 5 years younger than my chronological age, which meant I had mitigated. 5 years is kind of the magic number on that testing. So I had mitigated that risk entirely by having, pretty good lifestyle. I think for most of my life, I had a really good lifestyle. I slipped a little bit in the last 5 years during COVID, because I think, like lots of people, sort of
Yeah.
disrupted my life. So, I was an athlete when I was younger. I played tennis and I ran track, and I played tennis in college even. So I
Mm.
spent a lot of my life exercising significantly. And so I think that kind of protected me, and was probably the reason why I had that lower brain age to begin with. But when, in the last 5 years, I'm coming up on my 45th birthday, so I'm also sort of in perimenopause territory, which for women, tends to result in some
Hmm.
non-ideal health changes. It becomes
Right.
harder to lose weight, and your hormones get out of whack. And I was starting to have sleep problems. I was waking up 3 or 4 times in the middle of the night per week. I'm having a hard time getting back to sleep. And then the next day, of course, you're tired, so you don't want to exercise because you've had a horrible night of sleep. I think a lot of people can relate to this.
Yeah.
So, my blood pressure had been, when I was younger, in my 20s, it was like 100 over 60 pretty standardly, right? So, really on the low side. And it had creeped up to 139 over 89, which is
Hmm.
like still 140 over 90, right? Is the traditional cutoff for what high blood pressure is. Although there's been more recent studies that have shown you really want it below 120 over 80. And maybe you have
Right.
thoughts on that. But, you
Agreed.
know,
Yeah.
there's an optimal range. There's what's, you know,
Hmm.
considered to be hypertension, and then there's really an optimal range, which is 120 over 80. And for me, maybe it's even lower, because my baseline when I was exercising a lot and younger was at that
Hmm.
really low end of 100 over 60. So my blood pressure had creeped up. My hemoglobin A1C was like good, but sort of on the borderline as well. It's like 5.6, right, which is kind of right on that
Sure.
pre-diabetes. And my fasting glucose was at, I think it was 95, so also sort of on the upper end of normal. So there were some markers that were kind of trending in the wrong direction for me.
Right. Right.
And so I did a bunch of stuff. Well, I started going back to hot yoga, which I am a huge fan of, because you get sauna and meditation. And the one I do is a little crazy. It also involves weight and burpees. So I go to this class called Core Power Yoga. So it's like more than just yoga, it's like really intense. So it's kind
Yeah.
of like a HIIT class. And so I started doing that again 3 days a week. And I also started hormone replacement therapy, which entirely fixed my sleep.
Sure.
So, and can talk a little bit about that, but there's been the black box warning was just removed
Right.
by US FDA.
Hmm.
And so I got hormone replacement therapy, had a lot of bad press for a long time, but newer studies
Yeah.
have shown that it's really preventative for dementia. I think if started in middle life for women, it's a 30% less reduction
And
in dementia risk.
were you having, to get personal, were you having hot flashes and everything as well? All the things?
So I was having, so sleep disturbance is a criteria.
Yeah.
which I was definitely having. I
Yeah.
was having the occasional night sweats, which was
Okay.
contributing to my sleep disturbance
Yeah.
and some weight gain, and certainly like fatigue and low energy,
Yeah.
which might have been secondary to the sleep disturbance. But and my regular primary care doctor, who I go through One Medical, actually wouldn't prescribe me HRT, which is a really common story
Really?
for women.
Don't you
Yeah, she
hate
gave
that?
me yeah, it's so bad. I mean,
Yeah.
she gave me over-the-counter birth control, which is not the same thing, the
No.
oral at all.
Yeah.
And I kind of humored that situation. I tried it for about a week. It was just not the right thing for me, and
Yeah.
so
Yeah.
so I ended up going to MIDI, which I love them so much. So they're telehealth provider, and they're predominantly focused on women's health, but they
Okay.
prescribe HRT amongst other things just with a telehealth appointment. So they're fantastic.
Yeah.
And so that's how I ended up going on the HRT. And yep, so I did that. And I didn't mention my cholesterol levels were also trending up. So my lipids had gone up steadily. Even as like a 20-year-old, when I was running half marathons, like the best shape of my life, my total cholesterol was 200, which at the time I thought was strange, right? It's on the high end of normal.
Mm-hmm.
And it turns out that people with ApoE4 alleles actually have problems with lipid regulation. So they often
Right.
have higher dyslipidemia, higher lipids. So
Do you
part of that
remember what
is
like your ApoB and LD? Do you remember those numbers?
I had my first ApoB like 2 or 3 years ago. So, and this like 200 level was from the early 2000s. I don't know if people were
Okay.
even testing
Yeah.
ApoB at that point, but certainly the doctors I was going to were not.
Sure.
So yeah, I wish I had the record of those numbers from
Well,
before.
yeah, I mean, from like 2.5, 3 years ago, whenever you kind of started this whole journey, if you knew, I was just curious if you knew what your ApoB was or your any of those other numbers. Okay, that's fine.
I didn't. I knew. I had total cholesterol, like a CBC,
Yeah.
and then LDL and HDL. But I mean, this is why having a longevity doctor is so cool, right? Because even my regular doctor, primary care, really great primary care doctor, wasn't testing those things 3 years
Yeah.
ago. So I don't have a baseline for some of those
Okay.
numbers.
Okay.
But I think everybody should. I do have the
Sure.
last three measurements now for those.
Okay.
Um, so so I my total cholesterol was up to 280,
Wow.
and it's high.
Yeah.
And even then, my primary care doctor said, well, you may or may not want to start a statin because your 10-year risk of cardiovascular disease is low because you're metabolically normal and, like,
Mm-hmm.
so
Mm-hmm.
So I ended up kind of talking her into rosuvastatin, which of all of the cholesterol medications, that one has the most evidence for dementia prevention. So some of the
Yeah.
newer studies have shown
Yeah.
big decrease in dementia with starting a statin. Even people with normal LDL levels, there's still a dementia prevention for starting a
Mm-hmm.
statin.
Mm-hmm.
And rosuvastatin doesn't cross the blood-brain barrier, interestingly, and your brain produces its own cholesterol. So it's actually not really touching the cholesterol in your brain. It's
Mm-hmm.
just affecting cholesterol in the overall body. So I started that and in a multivitamin. So I was a little bit vitamin D deficient as well.
Yeah. It's low
And
hanging fruit right there.
yep,
Yeah.
yep.
Yeah.
And now I know I have MTHFR variants as well. I have recently found that out. So B vitamin supplementation is really important for me, which I wasn't
Right.
doing before.
Right.
And so I improved a bunch of markers. So my blood pressure dropped dramatically. The one I forgot also is I started microdosing semaglutide. So I started
Yeah.
um, um, uh, zero point 0.5 of semaglutide, which I think the standard dose is 1.5.
Yeah. The starting. Yeah.
Um, yeah. So anyway, I did all of those. So who knows which of these things is the reason that things improved so much? Probably a combination of them. But
Yeah.
my blood pressure went down from almost 140 over 90 to 109 over 65. So almost back down to where it was in my 20s. My
And just
total
so note,
cholesterol.
I mean, everything you said, you didn't do any blood pressure medicine or anything there. You did a lot of lifestyle stuff. And we just touched on the hot yoga. You're doing other stuff other than that. But um, yeah, keep going there. And you made a mention of semaglutide, those GLP-1. Those have been shown to lower inflammation in the brain as well,
Hmm.
consistently. And I mean, I'm just waiting for some bad news to come out on those guys because I mean, the good outweighs the bad so much over and over and over. So, but yeah, I wasn't aware of that until this past year, kind of digging in on that. Anyway, fantastic. And so your blood pressure dropped, you're feeling better, you're sleeping better, your
Yeah,
hormones are fixed. This is
exactly.
all the path you went down 2.5, 3 years ago. And then, yeah, keep going. What else? What else you layering on there?
Yeah, so blood pressure dropped a huge amount, like 30 points systolically, right? So that's a giant drop, and that not with blood pressure medication, so all of this other stuff.
Yeah.
And my total cholesterol is now 160. I had my ApoB tested a year ago, and it was at 68. It's since come up to over 100, which I'm going to talk about in a second why I think that is.
Huh. And for anybody listening, I mean, I love an ApoB of 60. So you had a 60 done. So your ApoB was 60 within the past year or like a year ago. Is that what you're saying?
2024
Yeah.
fall, yeah. And then
Okay.
it shot back up, and I have theories about why this is. It's
Okay.
related to ketogenic diet and ApoE4 alleles.
Okay.
And so that was looking pretty good. My total cholesterol is 160 now. My
Mm-hmm.
HDL and LDL and triglycerides are all normal.
Mm-hmm.
And what else? So the big thing is, and my sleep is fixed almost entirely. So I only wake up once a month now in the middle of the night, and I have so much more energy.
You
And
only
so,
wake up in the middle of the night about once a month?
yes,
Okay,
yeah,
that's impressive. That's
yeah.
really impressive. Are you tracking that at all? Or do you have like a 8 sleep or anything like that? Or a Aura
I have an
ring or okay.
Aura ring corroborated by Aura. So I consistently get 7.5 hours of sleep, and I don't wake up at all.
Okay. Wow, that's
And
awesome.
it's so good. I used
Yeah.
to sleep like that, and then it deteriorated right around my late 30s, early 40s, and it was
Mm-hmm.
like a night and day. Progesterone and estrogen was like night and day, just fixed it.
Yeah. Yeah. That's great.
I wonder about that with also with men, because I know men start to have sleep problems as well, right?
Mm-hmm.
And I wonder if
Hmm.
there's some hormonal component to that, something I've been kind of contemplating
Yeah.
recently.
Actually, yeah. Men can use a little progesterone once in a while, and that can help. But okay. So what else did you layer onto that? I know there's more.
Yes. So the biggest thing was retesting my NeuroAge, of course, right?
Yeah.
I retested and I dropped my NeuroAge by 1.2 years. So overall, and the most important thing is my hippocampus volume increase. So your hippocampus is the
Yeah.
area of the brain that shrinks in Alzheimer's. You lose neurons there. It's your short-term memory area.
Is your house on
Normally,
fire? Do you
it's
hear
oh,
that?
can you hear? Yeah,
Yeah.
I'm in San Francisco, so I'm on a busy street.
Sound of freedom. Okay, go ahead.
So, your hippocampus normally decreases by about 1.5% per year in middle age.
And
Once
that's
you,
normal, or that's not normal. That's consistent. I mean,
that's
regardless.
average. Yeah, that's
Okay.
typical.
Gotcha.
That
Average.
doesn't
Okay.
mean that, yeah, it doesn't mean that there's something wrong with your brain. That's just typically how people age in middle age.
Okay.
And then if you end up with early Alzheimer's or mild cognitive impairment, that rate drops even faster. So it's more like 4% per year. But
Okay.
in middle age, we would expect 1.5% per year. So the
Hmm.
fact that mine increased by 1%, which doesn't sound like a lot, is actually, a net gain over the last year and a half of about 3% volume, because I was supposed to be losing it. Um, and that's fantastic, because that's really the bottom line for Alzheimer's disease, is preserving the volume of that brain region.
Did you make some significant dietary changes at all, or were you kind of dialed in there? Obviously, you were more cognizant about those decisions after seeing those genetic markers from almost 4 years
Yes.
ago.
So, I'm a big fan of Mediterranean diet. It has the most evidence of any diet. So that, for people that don't know, that's high fruit and vegetable, lean protein, a lot of olive oil.
Hmm.
And so my family's Italian. I'm Italian origin. So I kind of grew up with that diet
Yeah.
anyway.
Yeah.
But I think with the semaglutide, it certainly decreased my appetite. So I was certainly eating less food.
Hmm. Hmm.
And also, I've been consciously adding certain things to my diet. So, berries have been a big one, and that's for the polyphenols. So, I've been doing a berry smoothie with yogurt every
Hmm.
day. Also, fermented foods are really good for you, and yogurt is high protein and has all of those probiotics combined with the berries. So that's one thing I've tried to do daily. And then recently, I've been intermittent fasting. So this past fall, I actually had a function health panel. So I had a really complete blood work.
Right.
And I found out that there were a couple of things that were very surprising to me that had gotten worse since 2024, which were I had this increase in my ApoB. So my cholesterol levels were all pretty good, although I had kind of a pattern B LDL, which I guess are these small particles that are more likely to form plaques,
Right.
which is problematic.
Hmm.
And my CRP was a little on the high side, so it's 1.5. My ApoB had shot up over 100. I think it was around 105, if I'm remembering correctly. And so I was trying to figure out why that was.
Yeah.
It was really hard to get an appointment at Quest, um, especially a fasting appointment. So I actually did it at 3 p.m. So I'd been fasting for like almost 24 hours when I did the test.
Yeah.
And I had really high urine ketones. I was in ketosis, it was like levels like 3. And I had been intermittent fasting, which had put me in ketosis. I wasn't trying to be ketogenic, but I was kind of eating low carb and had been doing pretty serious intermittent fasting.
Right.
And it turns out, and I've heard this now, so I took a deep dive into it to try to figure
Hmm.
out if that could be related. And it turns out for people with ApoE4 alleles, sometimes, at least initially in ketogenic diet, you can see this bump in these inflammatory markers, including CRP and ApoB. I was listening to a Peter Attia podcast where he had Dom
Dom.
D'Agostino on. Yeah,
Yeah.
and they were
Yeah.
talking about the same thing in ApoE carriers. And there's some literature behind it as well, some studies. So that's just a little interesting side note. So for me, I'm gonna retest on dial back the intermittent fasting to more like 12-12 and
Hmm.
be low cal, but maybe not so low carb, and see if I
Hmm.
can fix my ApoB.
Hmm.
And if that doesn't help, maybe add something like Zetia. So it's going to be a conversation with my physician.
Yeah.
Yeah.
Did they say what the mechanism of that was? I've never heard that before. I'm not familiar
With
with
the
that. Yeah, why you have an increase in ApoB, and I guess anybody listening, we should explain what ApoB kind of surrounds the LDL and makes it soluble and makes it a problem. I think of it very simply. People you say ApoE and ApoB. So ApoB, we're talking about the lipids, but I guess why does ApoE4 carriers? Because I know a lot of the pathology in that has to do with how they deposit lipids and dispose of them. Correct me if I'm wrong, but So if what the mechanism of why that ApoB rises, I mean, I'm sure, whenever you go into a ketogenic or a nutritional ketosis, why that happens. Do you understand? No, I mean, we can cut this out if you don't. I mean, I don't know the mechanism of why that would happen. I'd just be speculating.
Yeah, so people with ApoE4 alleles have, I guess the simplest way to explain it is dysfunctional lipid transport. So it's a cholesterol transport problem. And
Mm-hmm.
ketogenic diet often is also high fat diet. And I
Mm-hmm.
think because people are sort of replacing what used to be carbs with more fats, I
Yeah.
wasn't doing that, but because of the fasting, it was mobilizing my own fat stores, which
Right.
look like high fat diet, even if they're coming from my body instead of what I'm eating.
Mm-hmm.
And because I have this cholesterol transport problem with my ApoE4 allele, my body wasn't able to deal with that properly.
Okay.
Is what I've been reading. And so
Yeah.
it's causing this inflammatory response. So the solution is to kind of dial it back and kind of have more gentle caloric restriction that's like not necessarily fasting for long periods of time, but just less calories every day. So we'll see if that
Yeah.
works. If not, it might be some more pharmacy involved.
So a lot of people track their ketones and it takes work to get into nutritional ketosis, and you were just in it from dietary changes and caloric restriction.
Which is also really interesting. I wonder what that's the first ketone measurement I've ever had.
Yeah.
So, I don't know if that's kind of my baseline to just have really high ketosis from fasting. 24-hour
Yeah.
24-hour fast is a good amount of time,
Sure.
um but yeah, I want to have more toys, so I'm probably going to order, things on the internet to track my ketones and
Yeah. Yeah.
so
What are you looking at? What are the toys you're looking at for, like, what are the Keto Mojo or the breath test, or
yeah, I've heard
what are you
good
looking
things
at?
about Keto Mojo. I don't know, maybe you have recommendations. I'm kind of a newbie to this space.
I don't have a recommend. I mean, the urine test is great. I don't know if the blood test, for that is fantastic. The urine's probably the easiest. I'd probably do the breath just because it's easy to do and pick up
Mhm.
on. So that's probably what I would go with. But Merry Christmas to you. Just go ahead and get one, right?
Yeah, absolutely. Yeah.
Did you ever do like a DEXA scan with body composition or anything like that before?
I haven't done one of those before.
Yeah.
That maybe will
Okay.
be my next stop. Oh, I have gotten in better shape though. My VO2 max, at least according to Aura, they have a 6-minute walk test. So I don't know how accurate it is, but it
Yeah.
went from 33 to 38, which I guess was kind of average to pretty good.
Yeah.
For every 3 points you increase in VO2 max, there was a study of middle aged women that decreases your dementia risk significantly. So
Mm,
I want to get in even better shape and increase that even more.
yeah.
So that's another thing I was tracking. My Aura cardio age went from 3 years younger to 7 years younger, which is really good. And that's measuring arterial stiffness. So that's pulse wave velocity that they
Yeah.
do somehow with Aura.
Yeah. Well, cool. Well, all that within 2.5 years, right?
Yeah. Yeah. It was actually the last year and a half that those measurements. But
Hmm.
so yeah, trying to blaze the way for other people.
Yeah.
Really show that it's possible. We also had one of our very first users come back with his second set of NeuroAge tests, and he dropped his NeuroAge by 2 years, which is really significant. And he's, in his 60s and has an ApoE4 allele and is taking care of his dad who has dementia currently.
Hmm.
So really meaningful. So he's on track to avoid Alzheimer's, which is kind of this huge relief, right? Especially when you see it in your own family.
Yeah. So he had images, and the decline of hippocampal size and all that was the rate dramatically decreased because of lifestyle and changes that we're talking about here. You touched on VO2 max. I'm just shocked. That's just almost, if I could do just one thing for people, it'd probably be that, because you can really link, your rate of aging. If you got a crappy VO2 max, you're really in trouble. I mean, other things can be managed, but if you get VO2 max up, if there's one thing to do, I think thing is, I don't know. We do that offer it to everybody, but yeah, super.
Yeah. What do you suggest people shoot for? What a VO2 max level?
I mean, if you look at the graphs, I mean, they just decline. So the higher you are on that, too, if you're 38, we want to be 42. We want to be higher. So, I mean, 38's great, but we want to get up and, 42, 43. I mean, it depends on your age, of course. I would say, so I'm 51. If I'm 50, I really want to get that higher. I'm about 40, but it needs to be, I'd like to bump up to 44, 45. It's just something that, so that's my big thing for 2026. Don't get arrested and increase my VO2 max. Really, those two things will be fine. But yeah.
Seems like great goals. Yeah. What do you find the best way is to increase VO2 max? Is it more like the high intensity or the zone 2 or
Yeah, both of those, the zone 2, but then the high intensity, interval training. I'll do like Tabatas all the time, or I'll do, hit that kind of stuff. But I went for a run because it was nice the other day, and I tried to just really sprint for a while, and and then slow for a while and get the heart rate back down and go up and down for about 20 minutes. And of course, the Norwegian 4x4s have been shown to increase VO2 max. So just that's never been something that I've never really enjoyed doing. So I'm trying to teach myself to really enjoy doing that over the past year personally. So I can't get on hot yoga though. That's I'm impressed with that. I've seen people go in and out of those classes and they come out just drenched and it looks miserable. It looks terrible. But I'll do a sauna. I love a sauna.
this is multitasking, sauna plus like the balance and resistance all at once. How many things can I pack into 1 hour?
Yeah. Oh yeah. It has to be reasonable. It has to be something you can fit in and do it consistent. How hot did they get in hot yoga?
It's 95 degrees about, so it's not
Okay.
not sauna level.
Okay. All right.
Pretty high. I think just sweating out, the average American and myself included eats too much salt. So just sweating out that salt, I think is really good.
Yeah.
Yeah.
So, you didn't do a lot of crazy stuff. A lot of this was just lifestyle changes. And you were to kind of go over your first NeuroAge was 5%.
5 years over 5 years younger.
Yeah. It was
So
okay.
yeah,
Go ahead.
I think it was 5.8 and it's dropped to 7.
And it's dropped to 7.
Yeah.
So your rate of hippocampal shrinkage and all that stuff in the brain had improved. And just, I mean, if anybody has done NeuroAge, they know that the images and everything there, very cool. It's machine, AI is involved, and some of the detail there is just pretty awesome. I'm really looking forward to doing our patient's NeuroAge again. She's been kind of scared, but she's feeling so much better. I took her off. I don't know if I told you this. I told her that she couldn't watch the news anymore or had to go on a
Yeah.
news fast for a while because we were just making her pissed off. So
Hmm.
you need to just stop because it's not going to help you at all. You're not going to do anything. It's just going to make you frustrated. So, but she's really been cognizant about lifestyle and some of the exercise she's doing. And we talked about, BDNF and all that kind of stuff and the clotho gene and everything. And we even kind of did some rapamycin on her as well. I don't know. Were you familiar with that as far as I don't know if we ever talked about that, the rapamycin study that was really small over the course of 3 or 4
Yeah.
months that they imaged pre and post. It was kind of
Yeah,
interesting.
I mean, I think there is some small positive studies now coming out for
Mm,
rapamycin for people that I think they're very promising. And of course, Matt Kaberlin has gotten his NeuroAge. He has a very young NeuroAge, and we know that he does rapamycin. So N of one for rapamycin and NeuroAge.
yeah. Yeah. He has a very young, he hadn't told me about that. I did hold his brain. You know, they give a 3D brain that you can purchase, and he has it on his desk, his replica of his brain. So anyway, not, it's kind of funny. Well, anyway, well, I want to be respectful of your time here, and I've kept you for a long time. What else do we need to cover? What else, anything else you want to leave us with before we get on? Let you enjoy the rest of your.
You know, I hope this is encouraging to people, and the people that are thinking that there's nothing they can do about it, they just have bad genes, and you know, it's in their fate.
Yeah.
You absolutely can do something about it, and the earlier the better, right? That you start, because then you have years to kind of study those volumes of hippocampus and make sure. What if I hadn't done any of this stuff and my lipids and blood pressure were still, you know, on the wrong side of things?
Yeah.
You know,
Yeah.
it accumulates over time. So I would say people, it's really good to kind of take your head out of the sand and take the bull by the horns and to start this stuff now and start working on things, because it really does make a big difference. And I've told you a couple of stories, but there's also, you know, randomized controlled trials that kind of back up some of this stuff with brain volume that we've seen. So really evidence-based.
Yeah. Yeah, the traditional way is to kind of wait until you have a symptom, or you know, and then you check, and then it's kind of, yeah, we really need to be checking this stuff in our 40s or even younger, 30s. Anyway, how did somebody go ahead?
And I think it can be, you know, really tailored to what you see. So, you know, the recommendations for someone who has a low hippocampal volume are different than for those who have a low cerebellum volume, in terms of what exercises to do, for instance, or what we see in people's genetics can really guide what might work for them. You know, I think having a complete picture is important for knowing how you might actually go about improving your brain aging.
How does somebody listening get in NeuroAge? Do they need to go through their doctor, or can they just get one straight up, or how does that happen?
Yeah, either way. So if you have a great longevity physician like yourself, that's a great way to get a NeuroAge. And then they can also help you, guide you with recommendations and guide you through that process. You can also get it directly on our website. We are available in about half of the US states, so you have to look at the MRI map, and if we're not somewhere where you are, then we're happy to try to set up a new location there. So feel free to reach out to us about that. And people can just order it at neuroagetx.com. That's our website. We also have a new app that's coming out, so there's a wait list. Sign up for the wait list to become one of the first users. It'll also give you some discounts on our testing. It's going to be really cool. So one of the questions we get all the time is we have this lifestyle quiz, and people that do better on the 9 pillars of healthy brain aging often have younger neuroages. And so people are asking, well, how do I track this over time? So it's going to have like a daily lifestyle tracker. So all of the things that we recommend, you can kind of do it daily. It's basically what I've been doing. Marking down on my calendar with little stickers is now going to be an actual app.
Okay.
And then there's also going to be brain training, but it's very selective. So we went through all of the literature, and the only type of brain training that has really good randomized control evidence is speed of processing training. So this is reaction time training. So there's been randomized controlled trials that show if you can decrease your reaction time through training, 10 years later, people had 30% decreased risk of dementia. And so there's one game in particular, it's called Double Decision, that can train your speed of processing. So that's going to be on our app. So a lot of cognitive training programs are really intensive. People get burnout, they get tired of doing them, but this one is going to be 3 minutes a day, 3 days a week. So less than 10 minutes a week of cognitive training just on this one game, Double Decision, and we'll track your progress. So you're going to have a score for that, and then we combine them, so it's gamification.
So it's a game that you can do to decrease your processing time, to increase, you know, and that's your exercising. And so it's something you can improve on by practicing it 3 times a week, 2 minutes a time, or 3 minutes?
3 minutes a time. Yeah.
3 minutes a time, 3 days a week.
And yeah,
And
so it's
that's going to be
really
on the app.
light.
When is Go ahead.
So it's a really light lift. We're trying to make it easy for people, something they might actually do, but really evidence based.
Yeah. So when are we seeing this app? When is it coming out?
So we're targeting 2 months from now. So we're February-ish. We would
Okay.
expect there's a wait list now at waitlist.neuroagetx.com. And if you share about it, it moves you up the wait list and also gives you some discounts on our testing. So we're going to have the first 100 people will get the very first version of the app, and then we'll gather some feedback and go from there. And I'm really excited about that. It's basically an app version of everything I've been doing to lower my own neuroage. And the speed of processing training, so it not doesn't just make you like faster in your reaction time, but it just speeds up your neurons in general. So it's also going to make you think faster. So it moves
Yeah.
across cognitive domains, which is really important. So some of the other memory games just make you better at that specific memory game, but this actually moves across and makes you sharper and think faster in general.
Yeah, it just crosses over into life and executive functioning and all that. So waitlist.neuroage.tx.com. Did I get that right?
Waitlist.neuroagetx.com.
Dude, it's been great to kind of see this whole thing evolve since we first kind of connected with the beginning of NeuroAge and everything. I think what you're doing is super cool and very near dear to my heart. And the more I talk to my patients, and we talk about longevity and optimizing for the last 10, 15 years of life, cognition is at the top of the list for sure. So I think that's the thing people care about the most. So you're really striking a chord here. So anyway, very cool story. And yeah, I'm looking forward to getting that app, and I need to do my NeuroAge myself. A lot of people, like my patient, was kind of scared, and she dragged her. We talked about it frequently, and you were like, "What's the deal with her?" And it's like, she's scared. And then we finally did it, and she's very optimistic and feeling so much better, and all this. So I think all these things in this app will be awesome for her and our patients as well. So very cool. Thank you for making the time, Kristen. I really do appreciate it, and I appreciate what you're doing.
Yeah, thank you so much, Kevin. It was really fun to be on as always, and I love what you're doing as well.
Well, hey, enjoy San Francisco and the holiday this week, and thanks everyone for listening. And we'll see you next time. Bye.